Good morning. So, we are continuing the lesson. Physiology and sports. This lesson we have discussed about sports injuries. Some of the sports injuries we have discussed in the previous video. All those injuries we have discussed in previous videos were the skin injuries. We have discussed on abrasion, contusion, laceration, and incision. We have discussed. Now, today we are discussing about the muscles injury. So, first there is the sprain. Sprain is a ligament injury. It may occur due to overstretching or tearing of ligament. Actually, most of the time we have seen that sprain is always it occurs at the site of the joints and mostly ankle joint, waist and wrist joint. So sprain occurs due to overstretching of tearing of ligament, because in this condition the muscle twists, and by twisting the muscle cause the injury of ligament, because muscle group is twisting, and mostly it is called by the faulty movement when we are not moving properly. Many things can cause sprain: falling, twisting, or getting hit can force a point out of its normal position. So, this is also the cause. Sometimes due to hit by any object to the muscle, and the muscle is the joint at the site of the joint, the muscle is unable to bear that pressure, so it turned maximum more than its range, so that causes twisting of the muscle. So this can cause ligament around the joint to tear. Generally, sprain occurs at wrist and ankle joint. Generally, otherwise the sprain can be anywhere at the site of any joint. So sprain is mainly caused in sports due to faulty movement that I was telling you earlier. Sprain is mainly caused in sports due to faulty movement. When we do not know how to move, the movement is wrong, so then definitely the sprain can occur. In normal life also, the sprain also occurs due to faulty movement. There is immediate inflammation and severe pain along with no movement can be seen. Severe inflammation immediate inflammation and severe pain. Pain is high pain we can feel after the sprain, and definitely the sprain is highly painful. Sprain, the efforts, the time which it has taken is very small. In a very few seconds, the sprain is caused, and it is highly painful and takes a lot of time to cure. So, see the sprain here. In picture, we can see ankle sprain, first one, picture. Then ankle sprain, we can see damage to ligament of the ankles. Ligaments we understand, then we have studied in previous videos also. Then physiology chapter. Ligaments, these helps to attach the muscles to the bone. So ligaments are the joining uh, joining structure. They helps to join one bone to another with the help of the muscles. So the next picture at the right top you can see this is swelling occurs immediately. Swelling, inflammation, and sometimes bruising of ankles that we have studied in previous skin injuries. So bruises can be seen also. Bruises are the contusion that we have studied in previous video. You can see in my YouTube channel I have uploaded. Management of the sprain. How the sprain can be managed. So sprain, when there is severe pain, so first of all I think this is the proper remedy, that first aid therapy, applied topical analgesic to reduce pain and inflammation. First of all, because person suffer with severe pain, so apply the topical analgesic to reduce pain and inflammation. Topical analgesics are there. Just for information, I want to tell you, topical analgesics are used for only for outer skin. Topical means they are used only from outer side, not over any bone. And these topical analgesics are not a treatment. They contain capsaicin. Capsaicin is the component of pepper or chili. So that capsaicin cause burning sensation over the affected area. So brain receive the burning sensation rather than the pain. So the feeling of pain is delayed actually. Actually the feeling of pain is delayed. Pain is already there, but pain is only the feeling, nothing else. Damage will be there, that will be cured by the doctors and by the treatment. But feeling is known as pain. Inflammation can be seen, swelling can be seen, but the topical analgesic work as a pain reliever. They relieve pain by applying over the affected area. So topical analgesic can be used for reducing the pain and inflammation. Eraser therapy can be given. Eraser therapy we know: R for rest, I for ice, C for compression, E for elevation, R for rehabilitation. So this is eraser therapy. Eraser therapy should be given. In case of severity of injury, avoid movement immediately, because severe pain treated as fracture. This is very important with sprain. In case of severity of injury, if there is severe pain, the person is unable to touch the affected area, and the ligament has been displaced from its position. So in this case, in case of severity of the injury, avoid movement immediately, because severe pain, sprain treated as fracture. It is just like a fracture, and it takes time. Sprain also takes time. Sometimes normal fracture is treated easily and quickly than sprain. Sprain always takes time. So go to the doctor for further treatment. Immediately after the first aid therapy, we must go to the doctor for further treatment. Some pictures I will show you for the sprain. See how the ligament is leaving its place. We can see its attachment, and we can see how it is moving away. Then normal strain can be treated by the warm bandage also. So this keeps the area tight, the affected area tight, and which helps the joint and the ligament get a position. Inflammation we can see like this. The injury, after the injury, the affected area initially looks like this, and then see the blue structure. The faulty movements, when the joint, the step is kept in a wrong way. So another one is strain. Sprain is now clear. This is twisting of the muscles. Due to the twisting, sprain I am telling you, strain I will come forward then afterward. Sprain, the previous injury we have discussed, sprain is the twisting of the muscle, and twisting of muscle caused the ligament to leave its place. and that is the known as sprain, minor to severe, minor to major. It can become minor to major, and sprain takes already near about more than 1.5 month. In case of when properly we are treating sprain, it takes more than 1.5 month. Another one is strain, muscle injury. Strain is the injury. Strain is a type of acute injury that occurs to the muscle or tendon. Tendons are the softest and smallest structure, joining structure of the muscles to the bone and muscles to the tendon. Similar to sprain, it can vary in severity from a stretching of a muscle or tendon to a complete tear of a tendon from a muscle. Some of the most common places that strains occur are in the foot, back of leg, hamstring, muscle, thighs, or back. Strain occurs due to violent hit, violent pull, or violent pressure at the site of muscle by any object or movement. Sometimes suddenly we are pulling anything. Sometimes suddenly we are putting pressure on any side of the body. That associated muscle can have strain. Simple language, I can tell you that strain is when the muscle tears from in between. Or at the end also, when it is muscle tear, and due to tear of the muscle, the ligament connection is, the tendon connection is out from the connectivity. So the strain and sprain is little different. Sprain in which twisting of muscles and ligament leaves its place. Ligaments are broken. Broken means they are disattached. But strain, there is this is the absolutely muscle injury in which muscles are teared or crushed due to violent pressure or violent force. Muscles are crushed or teared. Sometimes in strain, the part of muscle group is highly crushed or ruptured. It is ruptured and crushed. See in the picture. The muscle group is ruptured or it is crushed. See one more picture of the strain. So this is, we can say that strain is when the muscle group has injury of like a wound, tearing of muscle or crushed of the muscle. Muscles are crushed. This depends on the pressure. Like if there is the heavy pressure, these muscles or some of the muscles may be crushed, or if there is little low pressure, so the muscles may be teared. But this is the severe than the sprain, and it also takes a lot of time to be cured. So second picture we can see that calf muscle strain. The site of the tear when the muscles are tear. See there, one more I will picture show you. This way. Sometimes the muscles are teared completely, sometimes they teared slightly, sometimes they are crushed inside. The grade 1, when there is the slightly damage on the muscle. Grade 2, when is there is slightly cut the muscle group. When completely cut in the muscle group, then there is the grade 3. So there are the grades, are the degrees of the strain. Degrees of the strain, these are the grades of the strain. When anything, any heavy pressure, violent pressure is applied over a soft part, so then this is the result. Either it will be teared or either it will be crushed. So that happens with the muscle in case of strain. I think this is very easy to understand now. Strain and sprain. Sprain is only twisting. The muscle group is twisting. By that twist, the ligaments are leaving their connectivity. Sprain takes less time than strain. Strain is very serious injury. Strain takes a lot of time, minimum near about 4 to 5 months. Strain takes a lot of time. So management of the strain we can see. Apply the topical analgesic to reduce pain and inflammation. First one is apply the topical analgesic to reduce pain and inflammation. In this also there is nothing, the injury is from outside. This is not a skin injury. This is the injury of the muscle only. Internally the muscles are injured or the muscle group is injured. So apply the topical analgesic to reduce pain and inflammation. This topical analgesic will help to send the message of burning sensation to the brain. That's why the brain will try to forget that the pain of the strain. Slightly the pain will be reduced, definitely. Apply the topical analgesic to the affected area. Second, ricer or price therapy should be given. Ricer or price therapy. Rest, ice, compression, elevation and rehabilitation is the ricer therapy, and price therapy is protection, protect, rest, ice, compression and elevation. So these therapy can be given as we have discussed in previous slide, that sometime we need to give protection also, because severe strain is treated as fracture. So ricer therapy and price therapy should be given. Avoid movement immediately because strain can be more painful in movement. If they are movement, so strain can be more painful. It is highly painful, and even what I have seen that in strain the person is unable to move that affected area. Means if there is strain over the leg, the person is unable to move. There is will be no movement can be seen. So avoid movement. If you are shifting, someone is shifting the leg or that affected area, so avoid movement immediately because strain can be more painful in movement. If there is movement, so the internal bleeding is there, that may cause more serious problem in the muscle group, and that may cause the more damage to the muscle group or muscle site. Go to the doctor immediately for further treatment after giving using these first aid therapies. Go to the doctor immediately for further treatment, and don't forget about the rehabilitation therapy. Light physical exercises are helpful for rehabilitation. After treatment of the injury, rehabilitation therapy is also very important. In case of strain, the rehabilitation therapies are very important. Otherwise, the muscles will remain weaker. So, this is all about the muscle injury. What were two muscle injuries? First muscle injury is sprain, second muscle injury is strain. And we have discussed about the four skin injuries. Four skin injuries were abrasion, laceration, contusion, and incision. Four were there, and then two soft tissue injuries, these muscle injuries were sprain and strain. These six were the soft tissue injuries we have discussed here. So sprain and strain is, I think, clear. There is slightly the difference of the alphabet in those words, sprain and strain. Only one difference of the alphabet, but the injuries are definitely different from each other. Sprain and strain, where strain is highly painful, highly dangerous, and strain takes a lot of time than the sprain, but depends upon the severity. Same severity, the strain is highly painful and time taking injury. So sprain and strains are the muscle injury, and four skin injuries which are abrasion, laceration, contusion, and incision. So these four we have discussed, and these two muscle injury we have discussed. Skin and muscle injuries are known as the soft tissue injuries. So the soft tissue injuries are over here. So we will come to the next. This is about the bone injuries. Bone and joint injuries. The musculoskeletal system comprises over half the body mass. The musculoskeletal system we can understand, in which muscles are there and in which the bones are there. The musculoskeletal system comprises over half the body mass. The most common musculoskeletal dysfunction are joint stiffness. If the joints are stiff, so that is the major problem of the musculoskeletal system. Joint swelling, joint pain, bone being non-yielding structure and are damaged when excessive force is applied directly or indirectly. So these are the serious problems of the musculoskeletal system. Because musculoskeletal system word we are using because bone cannot work alone, muscle cannot work alone. Bones and muscles always work together. As bone is the framework of the body and muscles are attached with the bone and they helps in the movement, various movements with the help of the bones. Bones are rigid, muscles are soft. So that's why this musculoskeletal work together. Musculoskeletal system work together. So there are various problems that I have dysfunctions I have told you, that is stiffness of joint swelling, joint pains. Commonly we know these dysfunctions. Bone being non-yielding structure are damaged when excessive force is applied directly or the indirectly. Bone fracture. So what are the bone injuries? First we will discuss bone injuries and joint injuries afterwards. So bone injuries are there. These are the fractures. Most commonly these are the fractures. So bone injuries, green stick fracture, comminuted fracture, impacted fracture, transverse fracture, oblique fracture, stress fracture. As the joint injuries are there, dislocation of lower jaw, dislocation of shoulder joint, dislocation of hip joint. So joint problems are the dislocation and bone injuries are joint injuries are dislocation, bone injuries are fracture injuries. So green stick fracture, every fracture we will discuss in detail. So this was just one in slide I am willing to show you the list of the fractures. So what is fracture? A fracture is a break in the continuity of the bone or a separation of a bone into two or more parts. So a fracture is break. The bone is breaking down. Break in the continuity of the bone. Continuity means the bone is plain surface, plain is there. From outside it is very smooth and plain, but it is hard, but it is smooth from outside. So that continuity is broken somewhere, and separation of bone into two or more parts. The bone is broken into two or more parts. That is fracture. Fracture is very common. We know the fracture. We all know the fracture, and we have seen also the fracture. We have seen the fractured persons and the persons suffering with the fracture injury. We have seen a great amount of soft tissue damage may accompany this type of injury, because not only bone is being damaged, because bones are covered by the thick layer of the skin. So definitely number of soft tissues will be also injured there, but after that we will not consider it as a soft tissue injury, because this is the hard tissue injury. Because sometimes there is no damage to the soft tissue injuries, but the bone is fractured. So this is all about the introduction of the fracture. So we will discuss this topic in detail in next video. The all type of fractures, and so today it is over here. So we have studied about the muscle injuries. Today muscle injuries we have discussed, and introduction of fracture only. So fracture we will discuss in detail in the next video. In detail I will tell you. So I think it is clear to all of you that sprain, strain, how it differs from each other, and what are the therapies can be given. So mostly muscle therapy, that is the ricer and plyo therapies are given, especially in muscle injury. Sprain, that is ricer therapy is very common. So the joint injury also we will discuss. So this is for today. This is all about the muscle injury and part of sports injuries.